So the next topic, and I'm going to put big stars here, this is a fairly important topic that you guys need to understand and be familiar with. And that's the concept of the standard of care. The standard of care is defined as how a reasonably prudent person with similar training and experience would act under similar circumstances with similar equipment and in the same place. So basically, if you're running a call, you're making decisions the whole time that you're out there, and you're making decisions for how you're going to treat your patient. The standard of care is basically, given the level of training that you have, given the situation and the same equipment, did you do what a reasonably prudent person would do? Did you do what was expected of you? That's it. That's what standard of care is. Make sure you understand this concept, because this will come up again. So standard of care will be based to some extent on local custom. In some parts of the country, it's more common that patients, let's see, will be intubated as opposed to having just BVM. So using advanced airway techniques versus basic airway techniques. So it's going to be based on what we do locally, what drugs do we give locally. It's going to be based on, do you have similar training and experience? So is it an EMT or is it a medic? What's the difference? You're going to look at the protocols. So what did the protocol say? And then other factors such as location, hazards, and crowds. An example of a hazard. So it would be a reasonably prudent person, EMT, a reasonably prudent EMT would use a backboard and put a patient in spinal immobilization as they pull him out of a car wreck. However, if the car is on fire, it's more prudent to get the patient out of the car that's on fire than to necessarily worry with the time that it takes to get a backboard on a patient. Other things that help define the standard of care are professional standards, things like the American Heart Association. They have CPR guidelines. They have defined things that you should do when somebody goes into sudden cardiac arrest in front of you, and those are generally accepted professional standards of care. The American Ambulance Association has some standards of care. The National Association of EMTs, the Department of State Health Services, that should be DSHS. I have a little typo there. I'll go in and fix that in a little bit. So it's DSHS. And the Department of Transportation. All are professional organizations that contribute to standard of care. Institutional standards. So you may have standards for your service. One of the things that we did where I worked is if we had a patient that had a low blood sugar, so they're diabetic, maybe they took too much insulin, part of what we did was made sure they had food. If that meant that we had to stick around and cook them dinner, then we would go in the kitchen and we would cook them dinner and make sure that they had food. That's part of our standard of care where I worked. Regional systems can also have standards that they expect you to meet for standard of care. Now I'm going to talk about negligence. There are two different types of negligence. The first is simple or ordinary negligence, and the second is gross negligence. So simple negligence could be an omission. I forgot. I didn't know. Those types of things. Gross negligence, you have to basically prove that there was intent to harm. And how do we prove negligence? Well, we have to prove that there was a duty to act, there was a breach of duty, damages happened, so there was a poor outcome, regardless of the cause. And then to prove the negligence, we have to prove that the breach of duty is what caused the damages. So that's proving negligence. Proving gross negligence also requires that there's proof that there was basically intent to cause harm, that there was malicious intent. So duty to act. This means I have a job to do. In the state of Texas, if you are working on an ambulance, being paid or volunteer on an ambulance, you have a duty to respond to any calls that are sent to you. It could be that you have a duty to provide aspirin to your chest pain patients. A breach of duty is you don't do whatever it is you were supposed to do. Maybe you decide to go stop at Wendy's and pick up a cheeseburger before you continue responding to the call. That's a breach of duty. Damages, like I said, this is any poor outcome. It could be pain and suffering. It could be patient death. Whatever the poor outcome is, there has to be some sort of poor outcome. And then there's causation, which again is that your breach of duty, so you stopped at Wendy's instead of going to the cardiac arrest patient, the patient died, and because you stopped at Wendy's is the reason that the patient died, or the patient had pain and suffering, or whatever that poor outcome was. That is the set of elements that's required to prove negligence. The next legal term to be familiar with is abandonment. This is failure to continue treatment. This is termination of care without the patient's consent and or termination of care without provision for continued care. So maybe you're dispatched to a medical call and you get to the medical call and then it turns out there's a big fire, there's a house on fire. You're working on the fire truck and there's a big house fire. You kind of figure, oh, this is just a stub toe, not a big deal. Hey, the ambulance is on its way. We're going to go take care of this fire call. That's abandonment. If you initiate care with the patient and you terminate without the patient's consent or without provision for continued care, and by provision for it means there's somebody there to take care of them already, then that's abandonment. And you are subject to major trouble, losing your license, lawsuits, personal lawsuits, if you commit this crime. So here's some examples. Failure to transport. If you tell the patient, no, I don't really think you need to go to the hospital, and the patient goes, oh, okay, that could be an example of abandonment. Handing over care to lesser trained personnel. So here's kind of your list. This is actually EMT to EMT. This is equal. An EMT can hand over care to a paramedic, but a paramedic can't hand over care to an EMT unless all the paramedic is provided is BLS care, so basic level care. In that case, the paramedic can hand over care to the EMT. EMT cannot hand over care to an ECA, but an ECA can hand over care to an EMT. EMT can give over care to a physician, and an EMT can give over care to a nurse.